I want to share a mnemonic with you that you may find useful when making medical decisions. And the mnemonic is something that can be helpful in really memorizing something. So the mnemonic is BRAIN, BRAIN. And what it stands for, the B is benefits, the R is for risks, the A is for alternatives, the I is for intuition, and N is for not now or no. How does this relate to ketamine therapy? Well, if someone's on the fence and they're like, should I do this? Should I not? Or if their friend or family member is really encouraging it, you can apply this mnemonic to a medical intervention. So, for example, what are the benefits? Well, maybe they can help with my depression or PTSD or anxiety or chronic pain. What are the risks? Well, we do know that it can create changes in blood pressure and heart rate, oxygen saturation at varying doses, and by oneself, it can be dangerous. Next is the alternatives. Well, there's a ton of alternatives out there for mental health, like medications, transcranial magnetic stimulation, TMS, ECT. There's a ton of tools available, and to consider that. And then the intuition. And I think this one is really important. Like, what does my gut tell me? Our gut literally has its own nervous system. It's kind of like our mini brain, but located within our intestines. Like, what does my gut and intuition say? And then lastly is no or not now. I would recommend people lean towards that so that you have time to think about it and process before making a medical decision. Now, you can apply this brain mnemonic to any medical procedure or any interaction with a doctor, right? So if your physician says, hey, let's replace your knee or hip, for example. Well, think about the benefits, the risks, the alternatives, your intuition, and maybe not right now. Hope you find that tool useful, and I will see you in the next video.